We're doing the third microwave ablation in Windsor. So this one is in a patient's liver, and this is one of the procedures we can do that's minimally invasive that helps take care of cancer, whether it's in the kidneys or the liver. And basically the patient comes in and gets discharged within a few hours, so it's a completely outpatient procedure, and it's much better than the alternative of going for open surgery. In the past, some of these get referred to open surgery. The ones who aren't surgical candidates, those tend to get more referrals in for these minimally invasive procedures called ablations, which just means that we're burning a tumor and some tissue around that tumor. And in the past, we were using an older technology called radiofrequency ablation, so we were still doing some of these ablations, but we've recently been able to get this newer technology, which is microwave ablation, which burns hotter and faster, and the procedure time is much quicker, so there's less time that the patient is in pain and is potentially moving around, making it harder to hit a moving target. So basically it leads to better outcomes overall for the patient in terms of the treatment of the cancer, in terms of the experience going through the procedure as well. Once the needle is in terms of burn time, it's 4 to 6 minutes. So only certain patients where the tumor is small enough to ablate, there's nothing around it that we would risk damaging if we're burning a little zone of normal tissue around a tumor to make sure we've got all the tumor. So if it's too close to a vital structure, then this isn't a safe procedure. But if all those things are sort of in line, then we're able to do this minimally invasive procedure where the tumor's, again, small enough, they can't take it out by surgery, or the person's not a surgical candidate, in which case it comes to us. Since I came here, this has been sort of a 2-year project of mine to get this microwave ablation technology to Windsor. It's something that I used extensively in Toronto during my training, and it's been about a 2-year process to get this here, finally. Less painful, it works. We do all the follow-up imaging to make sure that that tumor's been taken care of, and at the same time, if there are other tumors that pop up, then we could also do the same thing and ablate those. It's bringing newer technology to Windsor so that patients can be treated locally and minimally invasively.
Well, as technologists, we're always right next to the doctor. We help him with every procedure we do. Doctor and tech work close together. So in this procedure, we're there for the patient. Anything the doctor needs, we do the imaging, and we also set up for the pump for our microwave ablation that we just did, and for support of the patient. In our old machines, we'd be there with the patient about 20 minutes burning the cancer ablation, and that's a long time for a patient to be in a procedure, and it's painful. Now we can do this procedure in 4 to 6 minutes, a lot faster. I notice right away that it's completely different than the last. Patients are more comfortable. Once the patient's sedated and comfortable, we start the burn, and you always know that that's where the pain is going to be in the 4 to 6 minutes. But watching these, it's amazing to see that the patient's not really in pain. But you also have to remember that that patient could be feeling something, whether the sedation's working or not. Well, seeing a lot of these procedures, you know that they're alone, they're scared. And you think if that was your family member, your mom, dad, husband on the table, you'd want someone to be next to them, making sure they know it's okay. And as technologists, we know exactly when that burn is going to happen. We start the button. So we know that's the most important part, that they're going to feel something, whether they'll remember it or not. You're there for them, and just make sure they know someone's next to them.
Yeah, procedure's all done. It went well. The fine balancing act now is that because the procedure is so quick, we get them sedated for the procedure, but we don't want them to be too sedated for too long, so we can still send them home after a couple hours. So that's the balancing act now, is to make sure they're comfortable for the short procedure, and then get them back awake right after that.
Okay.
Recovery room down the hall. Hopefully we'll keep her for another hour or so, give her a prescription for some medications, and send her home, hopefully looking as good as she did when she came in. It's great for patients for treating cancer, basically, in a minimally invasive fashion, as opposed to the alternative open surgery.